Heart syndrome is a condition triggered by sudden emotional distress. Unlike a heart attack, it does not involve blocked arteries. Researchers first noted the syndrome in cases where a spouse dies shortly after their long-term partner when there was no underlying heart issue.
Now, understanding of broken heart syndrome is expanding thanks to the work of a Lee Health medical resident. Wink News health and medical reporter Amy Osher has the story.
When a 57-year-old woman from Lee County got to Health Park Medical Center, doctors realized something was terribly wrong.
Whenever the heart failure is less than 30%, it becomes into severe heart failure, and in her case, it was 10 to 15%.
The cause of her sudden severe heart failure was baffling because the woman who chose to be unnamed for this story had no underlying heart condition.
No history of hypertension, diabetes, or heart failure previously.
Ilana Gavinsky is a second-year medical resident from FSU training at Lee Health. After the patient had a minor car crash a few weeks prior, Gavinsky studied her scans.
The ventricles are dilated, which is not normal.
The presentation led her to conclude this was a case of broken heart syndrome, also called Takotsubo cardiomyopathy,
which is known to be a transient condition of heart failure when the heart muscle gets stressed due to some incident. In her case, it was the car accident.
There's still a lack of understanding when it comes to the connection between emotional trauma and the body. I think a lot of people aren't even aware that there is a broken heart syndrome.
Correct, there is. And why it's called broken heart is because originally it was contributed to like a breakup, like a couple breaking up.
Connecting it to a minor car crash is stretching what's known about this syndrome and why Gavinsky and her team shared the case study with their peers. She also submitted it for publication.
The reason I wanted to report this case is because a lot of people don't realize that everything can affect the heart.
In some cases, broken heart syndrome results in death. Because of the quick diagnosis, the patient's heart is on the mend, almost back to normal after 3 months of treatment. Amy Osher, Wink News.
The American College of Preventive Cardiology is reviewing the case. The syndrome was recognized in the 1990s, and doctors report an uptick since the pandemic.